Unit VCS06 Endoparasites. For learning outcome 5, you need to understand common diagnostic tests that are carried out in veterinary practice. Assessment criteria 5C wants for you to be able to list and describe common endo and ectoparasites found in veterinary practice. And as part of this, you need to be able to identify them and also their life cycles. Endoparasites that you need to be aware of are our helminths. We focus generally on our cestodes and nematodes. Flukes are a type of endoparasite that would affect the liver of cattle and sheep, sometimes horses, however they do not affect cats or dogs in the UK. We also need to have an awareness that there are protozoal parasites that might be relevant and you may encounter in your time in practice. Our cestodes, commonly known as tapeworm. They are commonly known as tapeworm because they are tape-like. They have no digestive system or alimentary tract. They are hermaphrodites, which means that they have female and male reproductive organs in each segment of them. Their body is composed of 3 parts: scolex, procellum, strobilia, and also the proglottid. Task. Using your textbooks and other resources to assist you, complete a diagram of a cestode. Label the aspects of the body with the correct name and also its definition. Task. Research the following cestodes found in the UK. Ensure you make a note of who are the intermediate and final hosts of the cestode and produce a table with key points. Then complete a diagram of their life cycles. I would like for you to research Dipylidium carneum, the Taenia species, and Echinocus granulosus. Please upload this onto one file for your veterinary educationist to mark. How can we identify cestodes? It is sensible when educating owners in relation to both cestodes and nematodes, the differences in how they appear. This is something that you may see done at a puppy party with sample bottles passed around containing both said worms. If we were to be identifying a cestode, we would be actually looking for the little segments, and these may sometimes be found in the fecal matter, around the anal opening of the animal. And owners might say that they look a little bit like grains of rice, and that certainly is what we would be looking for. Generally, we use what we term a broad spectrum worming product that is going to treat both cestodes and nematodes. However, depending on your practice protocol may depend on what you use. So it's really worth finding out at this point, or just clarifying how your practice target cestodes and nematodes. Is it a broad spectrum? Is it a tablet? Is it a spot on what other things might it actually work against? We generally use products such as Milbimax, which is milbimycin. We can use cesticides that only target cestodes but not tapeworms, which is why it's so important that you do know the sorts of products that your practice is using, as it may be that that is, for example, part of your worming procedure, but that you would then need to add something else in to then actually target the roundworms as well. Nematodes, or as we commonly term them, roundworm. They are round in their cross-section. They have a GI tract, and most have a direct life cycle. They can be carried by a paratenic host. The roundworms that you need to be familiar with are our ascarids, hookworm, whipworm, heartworm, and particularly relevant at this point in time because we have seen certainly an increase over the years in relation to cases of lungworm, lungworm is now something for you to be very aware of, whereas in years gone by it wasn't as relevant, wasn't as prevalent across the country. However, unfortunately, we are seeing a lot more cases of it nowadays. Research the following groups and those that specifically affect our dog and cats. Ascarids, and this includes Toxocara canis, Toxocara leona, and Toxocara cati. Hookworm, whipworm, which we term Trichuris vulpes, and heartworm, which is Dirophilia immitis. Please note that this is not currently seen in the UK. However, an awareness of it is important, especially due to dogs that are imported from other countries, as these are the sorts of parasites that we may encounter over the years to come. And also, as we've already said, importantly, the lungworm as well. In relation to the task, I would like you to ensure that you make a note of the intermediate host if one is applicable, and also the final host. Make notes of key points and produce a diagram of the life cycle. Please upload this onto one file for your veterinary educationalist to mark. So how would we ID nematodes in our small animals? So it may be that we actually have physical presentation of the roundworm, that we are having them pass within their faecal matter. Signs can be that the animal is scooting their bottom, licking their bottom a lot, and generally seeming uncomfortable. This may also be related to any issues with anal glands. However, it could be a sign of a nematode. We can also, especially when it comes to our lungworm, we can also have a look at faecal samples in our internal lab using our modified McMaster or our Behrman technique to detect the eggs. First of all, in relation to the modified McMaster technique, and then in relation to the Behrman technique, we can actually look for larvae. Now, it may be that your veterinary practice doesn't carry out those sorts of tests in-house, so it might be that those samples actually go off to an external laboratory. What we should be doing in relation to treatment is actually ensuring that animals are receiving regular treatment and control of such nematodes. So depending again on the products that your practice uses, it may be that these products are recommended to give monthly. They may be 3 monthly. They may even be 6 monthly, depending on the sorts of potentially mixtures of different products that you are using. So it's really important to find out what you're using, what your practice protocol is, that you are very clued up on this, and that you have a copy of that protocol. We should be ensuring that we are worming bitches that are due to be whelping and keeping on top of not only the control of worms from their point of view, but also in relation to their offspring as well. And then once born, puppies are to be treated from 2 weeks of age. And again, it's really important that you find out what your practice protocol is in relation to young neonates and what we should be using, whether it's different products to what you would use for adult animals as well, is really important for you to be aware of. And we should be educating the public. We should be ensuring that they are keeping on top of the regular treatment and control of such parasites using the products that your practice sells. But also that they are making sure that they are removing any faecal matter when they're walking their dogs, and carefully disposing of any cat faecal matter as well.